Continuing with Objective 4, now we're going to define, pronounce, and spell surgical terms related to the eye. So we'll start with the ones built from word parts. Blepharoplasty, surgical repair of the eyelid. Cryoretinopexy, surgical fixation of the retina by using extreme cold. Dacryocystorynostomy, creation of an artificial opening between the tear lacrimal sac and the nose to restore drainage into the nose when the nasolacrimal duct is obstructed or obliterated. Dacryocystotomy, incision into the tear lacrimal sac. Iridectomy, excision of part of the iris. Iridotomy, incision into the iris. Keratoplasty, surgical repair of the cornea, corneal transplant. Sclerotomy, incision into the sclera. So now, this is the surgical procedure performed to replace the cornea. The eye will have this appearance, and that is a keratoplasty. And now surgical terms not built from word parts. Enucleation, surgical removal of the eyeball, also the removal of any organ that comes out clean and whole. LASIK, laser procedure that reshapes the corneal tissue beneath the surface of the cornea to correct astigmatism, hyperopia, and myopia. Phacoemulsification, method to remove cataracts in which an ultrasonic needle probe breaks up the lungs, which is then aspirated. Photoreactive keratectomy, procedure for the treatment of astigmatism, hyperopia, and myopia, in which the excimer laser is used to reshape or flatten the corneal surface by removing a portion of the cornea. Retinal photocoagulation, intense beam of light from a laser condenses retinal tissue to seal leaking blood vessels, to destroy abnormal tissue or lesions, or to bond the retina to the back of the eye. Sacral buckling, procedure to repair retinal detachment. A strip of sclera is resected or a fold is made in the sclera. Trabeculectomy, surgical creation of an opening that allows aqueous humor to drain out of the eye to underneath the conjunctiva where it is absorbed, used to treat glaucoma by reducing intraocular pressure. Vitrectomy, surgical removal of all or part of the vitreous humor, used to treat diabetic retinopathy. And then there's not very many diagnostic terms, so I'm just going to go over those right now. So we have fluorescein angiography, radiographic imaging of blood vessels of the eye with fluorescein dye. Keratometer, instrument used to measure the curvature of the cornea. Ophthalmoscope, instrument used for visual examination of the interior of the eye. Ophthalmoscopy, visual examination of the eye. Optometry, measurement of vision. Pupillometer, instrument used to measure the diameter of the pupil. Pupilloscope, instrument used for visual examination of the pupil. Retinoscopy, visual examination of the retina. Tonometer, instrument used to measure pressure within the eye, used to diagnose glaucoma. Tonometry, measurement of pressure within the eye. So we have one question here. So which of the following would be preferred during an eye exam in the ophthalmologist's office? So hopefully you are choosing letter C for retinoscopy, because of course you hope they're not going to remove your whole eye with the very first option, enucleation. So letter C is your correct answer, and then letter B is just the instrument used to measure pressure. So that is the end of this recording.